So let's talk about neurotoxin. When I say neurotoxin, I'm talking about Botox, Dysport, Xeomin, there's Jeuveau, there's a lot coming onto the market. The ones that I most commonly use in my practice are Botox and Dysport. So the things that I like about Botox particularly is that it's been on the market a really long time. It has the most clinical trials, it's been well studied. What I really like about Dysport is, in my opinion, I find that it kicks in a little bit faster. It has a greater area of effect where it spreads a little bit more, and I find that it lasts longer. So on my face, myself, I use a combination of Botox and Dysport. So I'm gonna show you the areas that I treat. So when I treat, we like to call this the glabella region, okay? And so we have two muscles here, our procerus and our corrugator, and they contribute to making the little frown lines. So I will treat with about 4 units here, 4 units here, 4 units here. So on-label dosing is about 20 units. I go a little bit less because when I'm in the operating room and I'm using loupes, I like to scowl and I like to keep a little bit of movement. So dose equals duration. So the more you use, the longer it's gonna last. So if you use lighter amounts, you're just gonna need to treat more often, and that's just something to keep into account. If you are doing neurotoxin and you're noticing it's not lasting as long, it might be time to adjust your dose. So for me, I am edging on needing a blepharoplasty, which means that my brows can get a little bit heavy. So I go light with my forehead treatment. I use Dysport in my forehead. Again, like I said, it has greater area of effect. We have our frontalis muscle, which is the only brow elevator. So if I'm wanting a Botox brow lift or a neurotoxin brow lift, we want to be careful and not overtreat this because it's the only thing that lifts and you can get a little bit heavy. So I do about 8 units of Dysport in my forehead, and the unit wise of Dysport to Botox is a little bit different. So in reality, that's closer to 8 times 3, about 24 units in Dysport verbiage, but if we're comparing them to Botox, we say 8. So I will do about 2, let's see, my marker's running out, 2, 2, 2. And I stay nice and high because I want to stay away from dropping my brow. Okay, I go very light when I treat around my eye. We're treating the orbicularis oculi. It's a circumferential, it's a sphincter type muscle, and that's the one that contributes to the little wrinkles around here. And so this is something where if you were someone like me, where when your cheeks get full and they sit, I don't like how that looks when I'm overtoxed here. So I go very light. On label units, it's about 12 to 14 here. I do about 6 units. So, and I do a little bit right here at the tail of my brow, which is gonna help get a little bit of a brow lift. So my 2s aren't very pretty with this marker, but we get like a 2, 2, 2. So we're gonna do dots, and same thing right here. If you come in and you ask for a brow lift, I'm gonna do a little bit of tox right here because this orbicularis muscle is a pull down muscle. Your corrugator and procerus are pulled down. So we wanna keep that frontalis pulling up and all the pull down is softened. So here at the lateral tail of the brow, 2, 2, 2. I personally have a little bit of a crooked smile. So when I smile, my right eye closes a little bit more. And you can see this is this little folding right here. This is your muscle that's folding through. So I call that the jelly roll. So I will do on this side, just on my right side, a little dot of tox right there. And we call that jelly roll tox. Some patients like to do it on both sides. It can help with the wrinkling that you have underneath your eyes. Or if you have asymmetry, we can do one side, or we can do dosing higher on one side than the other. Let me get another marker.